Another Thursday for us to discuss on health-related matters. Good afternoon, ladies and gentlemen. Thank you for joining me on this edition of the program You and Your Health, aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Today, we are going to be discussing on sexual dysfunction in men especially. There has been a high prevalence of sexual dysfunction amongst men recently. Erectile dysfunction is currently one of the most common sexual dysfunction worldwide, but it is usually underestimated. The fact that most men suffering with this problem are often stigmatized makes them to suffer in silence. We are going to be discussing more on sexual dysfunction in men after this short break. Once more, good day. With me in the studio is Dr. Divine Oyongeta, a urologist at the Douala General Hospital. It is a pleasure having you on the program today.
Thanks for having me.
So today we'll be discussing on sexual dysfunction in men. What exactly does it mean, sexual dysfunction?
Yeah. Sexual dysfunction groups a variety of sexual disorders, amongst which you have erectile dysfunction,
which is our main focus today.
Which is our main focus
exactly.
Today. Ejaculatory disorders, mostly we talk of premature ejaculation, which is widely known, and you have other things like hypogonadism, anorgasmia, and
there are many
of them.
Okay, so our focus for today is erectile dysfunction.
Yep.
What does it mean?
Erectile dysfunction is the inability to be able to obtain or maintain an erection sufficient enough for satisfactory sexual performance.
So now, how long does an erection has to take?
It varies from one individual to the other.
Okay.
What is important is for people to understand their erectile function, because erectile function will vary from one individual to the other. And the erectile function or the sexual response has four phases. You have the desire, you have arousal, then you have orgasm, which is a hallmark, and then you have resolution. So each of these phases of the sexual response cycle can present with disorders, for example. So erectile dysfunction is just a disorder of arousal, which is basically about erection.
So does it mean it's not normal for a man to have an erectile dysfunction?
Erectile dysfunction can occur occasionally.
Okay.
And that would not be a problem. It's not necessarily a problem. Erectile dysfunction only becomes a problem or concerning when it becomes ongoing and causes problems in a man's life, like causing lack of confidence, annoyance, frustration, distress, relationship problems. At that point, it is necessary for the patient to seek medical attention.
And now, what can really cause such a situation to happen, especially in men?
Yes, so there are many causes.
Let's say 4 main causes, especially with the context of Cameroon.
Erection is a complex. It's a complex problem. It involves, the arousal, which has to do with environment, your brain, your hormones in the body, nerve transmission. So we can have, maybe say, 4 major causes. Okay. The first cause, most of the time, is psychogenic. Okay, and this can be due maybe relationship disorders, stress. You can have performance anxiety, men who want to maybe try to prove themselves. That's psychogenic. You can also have organic cause, which is something common. It is a major cause of erectile dysfunction. You have hypertension. You can also have traumatic causes, like a person who develops a stroke or a pelvic trauma, from a fall. Those can have direct injury to the nerve and cause erectile dysfunction.
And can such type of people impregnate a lady?
Yes. Sperm is produced in the testes, which is completely different area involved in, fabricating, and you just have to use your penis for copulation to be able to ejaculate and impregnate a woman. So, yes, I would say somebody who has erectile dysfunction can be fertile.
Okay. So now, in a case where the man, he has a type of woman that can really arouse him, what will really cause him to still have erectile dysfunction if he does not have diabetes, like example you gave, or hypertension?
I have listed a number of causes concerning erectile dysfunction. I said, and most of the time I'll tell you erectile dysfunction is of a psychogenic origin, which can be due to stress. Stress from any point. It can be job stress, social stress, financial stress. It could be due to most of the time what we call performance anxiety. Okay? A man feels maybe he is not sufficiently or he's not capable enough, and he's afraid that he may not be able to perform, and so just that fear creates that weakness, and that disturbance in the brain can end up creating, insufficient erections good enough to perform a satisfactory sexual intercourse. So those are some of the problems that can cause erectile dysfunction.
Okay, as a specialist, do you think a marriage can survive with such a condition? With a man suffering with such a condition?
It's difficult to answer that, but I think sex is part of the intimacy in any couple.
Yeah,
and I think that is even where erectile dysfunction becomes problematic.
okay.
Because, as I said, men can have problems with erections which may be occasional, but it becomes problematic when it is ongoing and it starts causing stress, relationship problems, especially within the couple.
Okay.
So I would think that it is very important for people to work hard. If they have difficulties, consult to seek medical attention and get their erectile function improved, to be able to live a comfortable relationship. In fact, erectile function has a direct association with the quality of life of a man, and I would say the couple in general.
Okay, you have been into this profession for a long time. So now, what percentage of men suffer with erectile dysfunction? Let's just say with the case of Douala. Is it really high, or it's just medium or low?
Anyway, studies have shown that erectile dysfunction can occur 1 out of 5 men above the age of 20 do suffer from erectile dysfunction. So it's a serious problem. So you can even see that people between the ages of 20 to 30 years can suffer. Even young men can suffer from erectile dysfunction. And as I said, 1 out of 5 men do suffer from erectile dysfunction. And it is a very common problem that the urologists would encounter during their consultation. So
but age equally has a lot to play, right?
Of course, age has a great role to play, because when men age, there is this male hormone which plays a lot in our erection, which is called testosterone. Testosterone decreases with age, and so it is very normal to see that erectile function decreases with age, and so it is common to find men as they age, they have the tendency of developing erectile dysfunction.
Okay, now what are the major symptoms? How can a man tell he's suffering with such a condition?
Yeah, basically it is that difficulty to obtain or maintain an erection. And but how would it manifest? The patient would experience a soft penis.
Yeah.
And most of the time it would typically, the hallmark is that there is not enough rigidity at the level of the penis sufficient to penetrate the partner. And in that case it becomes really problematic.
Can the use of Viagra help such a condition?
Yeah, Viagra is a brand name of one of the medications we urologists use to treat erectile dysfunction. It is actually called sildenafil, and there are so many medications which are used to remedy this problem. So Viagra, or just like what it is called sildenafil, is just one of the medications. But there are myriad of oral medications that can be used to solve this problem.
Okay, I think we are left some few minutes. But before then, I want you to tell us, what are some natural ways of treating such a condition?
I think the first thing is for the man to understand himself, and understand his capacity, and understand the couple, because I will tell you that each time you meet a partner, a new partner, there is definitely a change in, sexual performance, depending on how used to you are with that
been-
particular partner.
Okay.
That's why it's always comfortable to have a partner with whom you're used to. You can communicate, and it's very, very important. Communication is important because sex is not all about penetration. You will believe me that there are some men who have sex without penetrating, even with a woman. So it actually involves communication to understand your partner and understand your priorities, your demands, and from there you can now know how to operate.
So now, is there a cure for this condition? Like, if someone has been having this condition and you can take these drugs and say you have been cured totally from such a condition?
I think it is geared towards identifying the cause, and from there you can treat the condition.
Okay.
Yeah.
From the
Because
cause,
the
from there
causes
you
are
can...
different. Treat the condition. Yeah.
So now
So you can get cured depending on the cause.
Okay.
Yeah.
So then
And
now,
depending on the severity too.
let's now talk of diagnosis. How is diagnosis being done? Can just like touching and knowing that, or you have to go to the hospital to really confirm?
Yeah, diagnosis of erectile dysfunction. There are a few tests that can be used to diagnose erectile dysfunction, and I'd say it is geared as looking for the specific cause. Most of the time, you have very few investigations, especially in our setting, that can be used to diagnose these problems. And basically, we rely on the sexual experience of the patient. Okay, you have to take a complete sexual and medical history, sexual history to understand, I'll say, the psychosocial history, and then you get the medical history to know if the patient has a tendency of developing something like hypertension, diabetes, if he has had a trauma, if he has had a stroke. Those are all possible causes of erectile dysfunction, and so you want to identify those causes from the history, and then you can streamline the different investigations, to be able to diagnose the problem. You would want to understand that there are some of these patients who, for example, they don't know if they're diabetic or hypertensive, but when they come for consultation, we take a history, do a proper physical examination, and we perform a few ancillary tests, like just the fasting blood sugar to check for diabetes, or a lipid profile, which is a battery of tests to check for abnormal fats in the system. We end up diagnosing maybe hypertension or diabetes, and this is a patient who didn't know he was diabetic, he was hypertensive, and so it becomes... so erectile dysfunction per se is just, it's an eye-opener to many other diseases, even in cases like cardiac problems, okay? Because don't forget, erection involves blood filling up in the penis for you to obtain an erection. So if the heart cannot pump enough blood,
it can't work out.
It can help you to get a rigid erection sufficient enough. So most of the time, the patient is suffering from a heart condition and ends up suffering from erectile dysfunction because he cannot have a rigid erection. He comes to the hospital, and when we want to evaluate, you find that this patient is actually suffering from a cardiac problem. These are basically patients you must have used medications to treat, and they are not improving. And you want to get a thorough or exhaustive evaluation. And when you check for cardiac function, you find that, their heart is not functioning very well.
Thank you so much for your time, Dr. Divine Iyongeta, urologist at the Douala General Hospital. For presentation, I am Immaculate Fogwe, and I received technical assistance from Raphael Dipanda. Have a lovely day in the company of more programs on Equinoxe Radio and, of course, television. So long.
Equinoxe Télévision, au-delà de l'image, nous rendons compte.
If you suspect you may have a coronavirus infection, please call your healthcare provider in advance and let them know you are coming. This can help them be prepared. WHO recommends preventive measures to reduce your risk. Wash your hands frequently using soap and water or an alcohol-based hand rub. Avoid touching your eyes, nose, or mouth. Avoid eating raw meat and unnecessary contact with wild animals. Avoid close contact with anyone with flu-like symptoms. When coughing and sneezing, cover your mouth and nose with a flexed elbow or use a tissue. Take particular precaution while traveling. Seek medical care early.